How to get rid of chest acne. To get rid of chest acne, you have to treat it first. Use a cleanser that fights acne, a topical zit zapper, or benzoyl peroxide. Make sure to exfoliate regularly. Prevent future outbreaks by wearing cotton or linen tops. Eat healthy and drink lots of water. As a last resort, disguise it with careful use of concealer or makeup. Part 1: Treating chest acne. 1. Choose a cleanser that fights acne. Use an exfoliating glove and a cleanser with 2% salicylic acid while you're in the shower. Make sure to replace your gloves every 3 months as they are breeding grounds for bacteria. Soaps containing these ingredients serve as shedding agents, which will help to curb acne. If you scrub too roughly, you'll deplete your skin's natural oils, and you'll irritate your acne. Always scrub your chest gently to get rid of dead skin cells. Take a shower every day. If you don't clean your skin, you invite sebum and bacteria to collect on its surface, causing acne. 2. Apply a topical zit zapper. The cream should have a concentration of salicylic acid between 0.5 and 2%. Smear the cream directly over your acne to dry out and heal the spot quicker. 3. Use benzoyl peroxide. Benzoyl peroxide fights the bacteria that cause acne, and assists in drying out and peeling dead layers of skin on the epidermis. 4. Make sure to exfoliate. Exfoliating is removing the dead layers of skin on the epidermis, or the top layer of skin. Exfoliating can help decrease the incidence of chest acne and help acne marks fade. Chest acne is often the result of clogged hair follicles or pores, which causes sebum to build up. This ultimately leads to acne. Men tend to have chests covered with hair, while women tend to wear more tight, fitting bras and tops. Both of these may contribute to chest acne, making exfoliation very important, and make sure to wipe down with a cleansing toilet or toner after excessive sweating during a workout. 5. Smooth on a mask. Look for masks made of mud or charcoal, or try a mask that contains mandelic acid. Mud or charcoal mask. Rub this mask on your chest twice per week and then rinse it off. A mask will cleanse the area and unclog your pores. Mandelic acid mask. These masks are usually applied 10 to 15 minutes before a shower. Then, you'll rinse the mask off with some specially formulated acne wash. You can also try a clay-based mask or a mask containing tea tree oil. Many people think that tea tree oil is a good treatment for a variety of skin conditions. 6. Make an aspirin paste. Aspirin actually contains salicylic acid, which both dries out acne and reduces inflammation caused by acne. This makes it the perfect candidate for an effective paste. Crush 2 aspirin tablets and combine with 1 teaspoon of water and 1 teaspoon of honey. Apply to the chest, or where necessary, and let dry for 10 minutes. Wash off with cool water. Part 2: Preventing future acne on your chest. 1. Wear cotton or linen tops. Cotton and linen are the most breathable fabrics, and they let sweat evaporate instead of forming a layer on your chest that clogs your pores and invites bacteria to grow. 2. Change your diet. Eat a handful of walnuts every day to reduce skin inflammation. Eat more fruits and vegetables. Get lean protein, such as poultry breast or soy, into your diet, along with whole grains and omega-3 fatty acids. People who eat more fruits and veggies, and less milk and sugar, tend to have less acne. Make sure you get 5 to 9 servings of healthy vegetables, especially leafy greens, per day. Healthy fats, like omega-3s, help fight inflammation and promote healthy cells. Omega-3s are damaged by oxygen, meaning if you eat foods that are rich in omega-3s, try to eat them raw. Foods rich in omega-3s include fish, particularly salmon, sardines, and herring. Seeds and nuts, particularly flaxseed. Leafy greens, particularly spinach and arugula. 3. Drink plenty of water. Your skin is the largest organ in your body. Like other organs, it needs plenty of water to stay hydrated and functioning on a healthy level. Many doctors recommend that you drink between 9 and 12 cups of water per day, 2.2 to 3 liters, depending on whether you are a girl or guy. Cut sweet, sugary drinks like sodas, juices, and smoothies out of your diet. Although the evidence has been disputed for decades, new reports seem to indicate that diets do have a substantial effect on acne, listing sugar as a trigger. Sugars cause a spike in insulin, which in turn stimulates a certain pimple-producing hormones. Unsweetened green may work, too. Green tea contains antioxidants that help fight free radicals. Free radicals affect the cells that may be responsible for signs of aging in the skin. For a healthy alternative to water, brew some tasty and healthy green tea. 4. Skip dairy products. Dairy products contain hormones from cows, and these hormones stimulate your pores and your oil glands. If you have to drink milk, choose skim milk. The hormones are largely concentrated in the fatty portion of the milk, so drinking skim will limit your exposure. 5. Use non-comedogenic body lotion to prevent additional breakouts. Look for labels that say non-comedogenic or oil-free. Comedogenic ingredients have a tendency to clog pores. Comedogenic ingredients include cocoa butter, pigments and dyes, coal tar, and isopropyl myristate. If your skin is oily, you should always look for non-comedogenic lotion and cleansers. 6. Wash your hands after you go to the bathroom. If you have germ-ridden hands and then touch your chest, you transfer bacteria onto your chest skin that can clog your pores. So wash up. You'll not only prevent acne, but also a variety of diseases. 7. Remove as much unhealthy stress from your life as possible. Doctors aren't completely sure why, but they do know that there is a link between stress and skin disorders, specifically stress and acne. Somehow, the cells that produce sebum, which is the stuff that ultimately causes acne, become unregulated when a person experiences a lot of stress. Get plenty of rest. Doctors know that the less you sleep, the more likely you are to experience stress throughout the day. And the more stress you experience, the worse your acne gets. 8. Exercise. Exercising is almost a universal panacea. In this case, exercise promotes healthy circulation and helps ease anxiety and stress. So find an excuse to run, or walk, around the block, join an intramural sports team, or hit the stationary bike. Shower after you exercise. This is very important. Your pores may be clogged with sweat after you exercise. If you shower and clean them, there's a good chance that you might avoid some of the chest acne that is caused by simple neglect after exercising. Part 3. Disguising chest acne. 1. Dab your blemish with a cotton swab that you've soaked in hydrogen peroxide. Alternately, dab a blemish with a Q-tip that you've soaked in eye drops, used for redness relief. Eye drops can help reduce inflammation and the visibility of redness. For added relief, place the soaked Q-tip in the freezer for 30 to 60 minutes before applying. 2. Apply a concealer that contains salicylic acid. Choose concealer that's one shade darker than your skin tone. 3. Add a layer of foundation that matches your usual skin tone. 4. Dust your chest with powder. You should be good to go. 5. Try calamine lotion if you don't want to use makeup. The pink color masks the acne while providing relief from the irritation. Tips. If you spray perfume on your chest, discontinue that. It may aggravate your pores or close them. Acne can be aggravated by stress. Take steps to relieve stress so that you can minimize your chance of having a breakout. Change your sheets and pillowcases at least once a week. Not doing so lets all the dead skin cells and bacteria build up on the place you sleep, promoting acne on your body. Eat less fried food and avoid unhealthy drinks if possible, so that less sugar and oil enter from body. Don't let chest acne get you down. Almost 30% of those with facial acne break out on their chest at some point in their life. If nothing is working, talk to a dermatologist. You can use prescription creams or oral medications that will have marked results. When wearing low-cut shirts, try to wear a matching tank top to hide all those little imperfections. Try cotton as it is easier on the skin, but do not use fabric softener because it clogs the pores on your chest and create irritation. If you do apply lotion, try eczema lotion. It will not clog pores and it will moisturize. Don't make your own DIY recipe for pimples as it might contain something that can damage your skin even more. Check with your doctor before using any products you're unsure about. They can also prescribe something for you. Stop obsessing over your chest and stop comparing. It can be easily fixed. You should not compare yourself to those with flawless skin. A lot of them work for it too. Whenever you sweat around your breast area and you can't get directly to a shower, wipe your chest with 50% wintergreen rubbing alcohol and 70% witch hazel as a astringent to also clear up acne. Change your laundry detergent to a natural or sensitive laundry detergent that is liquid and has no fragrances. Any regimen that you try could take up to 6 weeks to work. Don't give up too quickly on something that may eventually be effective. Antiseptics can make a huge difference. They can be diluted into a pint of water and then washed over affected areas. If you have long hair, consider putting it up when sleeping. The oils from your hair can clog up the hairs on your body. Citation needed. Wear a necklace to take the attention away. Cover your chest. Warnings. Avoid picking at your pimples or popping them. Doing this can lead to further irritation, bleeding, and possible scarring. Talk to your doctor before you take oral medications for fighting acne, particularly if you're pregnant. If you're going to wear a scarf or jewelry to cover your acne, make sure you aren't sensitive to any of the materials in them. If you are, the acne can worsen.